So Carme Torras, thanks so much for...
Yeah. Well, first thing this morning, we've seen these robots folding clothes, so they can learn also other tasks by interacting with the environment. Now we have heard about social robots interacting verbally with people. And I think the next step or trend is to fuse both things. I mean, social robots that are able to interact not only with the environment, but also with people. So, for instance, we have been working for several years on helping people to dress. You will see this, well, and also doing other household tasks. You see robots that we have in our lab from PAL Robotics. And, well, these are other robots we have. I mean, that we develop prototypes with these robots, and then we miniaturize or whatever, you will see. By the way, I work at the Robotics Institute in Barcelona, which is a research center that depends on the Council of Scientific Research of Spain, CSIC, and Polytechnical University of Catalonia. And we are based in the Polytechnical University. And, well, in trying to deploy our prototypes to healthcare environments in which there are vulnerable people, because we like our robots not stay in our lab, but be really useful to the end users, not just patients, but also caregivers. So when deploying them in several hospitals that we've been collaborating with, we found a big reality gap, in the sense that one thing is they work at the lab, but working in a hospital is very difficult. And also the acceptance by patients and by caregivers sometimes is not so easy. So to close this reality gap, we have learned two big lessons. One is the need of co-creation, co-creating these applications together with all stakeholders, and also to share an ethics stance among all of them. And the first thing we did after the pandemics, because in the pandemics we thought that we could be much more useful than we were. We went to the Parc Sanitari Pere Virgili, which is a large hospital in Barcelona, and we showed several of our prototypes. And they said, oh, the killer application is feeding, because 50% of the patients we have here need to be fed. And at lunchtime, the caregivers do not have time to spend with them. I mean, 10 minutes, but people that cannot swallow well or that they do not eat enough. And also, they ask relatives to come, the son, and well, they go there, they are like machines feeding, and the patients are not satisfied because then they don't come at another hour to keep them in company. So we developed a prototype. Well, we showed first this prototype, and we interacted with the management in the hospital, with the innovation department, with medical personnel and nursing personnel, and caregivers. The prototype we had has a camera on the wrist and also force sensor. And when the person opens the mouth, looking at the camera, it feeds him or her. And when, for instance, the patient closes the mouth before getting fed, or closes with the spoon inside, the robot keeps quiet, do not break the teeth, and continues afterwards with the task. Well, when we showed this, the management and so on in the hospital said, oh, but we need that it changed, not only spoon, but, for instance, to drink with a small thing, straw, or also a tissue to clean, change several and automatically. So we devised this small prototype with a miniaturized arm which actually is a commercial product, but it's just an arm that does this. So we sensorized it, we equipped with software and so on. And then we deployed it in the hospital. We increased the performance of it, for instance, by showing to the patients, they said, oh, because the robot talks and says, well, I'm going to feed you. If you are afraid at any moment, say, hold, and I will hold, etc. But it had no face at the beginning. It was just a voice talking. And they said, oh, we like a face. Because, well, to relate, we know it's a machine, because we were very reluctant for patients to get attached. And we didn't want to put a kind of face or make it anthropomorphic-like. So we put just this cartoon face, and they were very much satisfied with it. And then we carried out a study with 60 patients of the hospital that was quite successful and was on TV. This is the TV in Catalonia. And we made, we asked for more financial support and also for technology transfer, more. And there was an association of patients that before doing the study were very reluctant because they say, well, at lunchtime, at least they get some human warmth. And after the study, since the patients were so happy with it, and they said, well, it's just a prolongation of the cutlery that we autonomously can handle, then the association said on TV, well, we understand that these are tools that can interact and so on, but we are very happy with them. So we somehow changed the mindset or the opinion they had. Another application, another prototype we did was together with an Alzheimer Foundation, also in Barcelona, in which in the daycare facility, they have several boards like this, 20 patients and one therapist going through the boards as in chess simultaneous game. So we also went to this facility once we developed this prototype, and you'll see how it works. This has sound in Spanish, but the translation is there.
Recuerda, estamos ordenando los números impares desde el más grande al más pequeño. Es tu turno. Por favor, mueve una pizza. No. La respuesta está aquí.
And provide some guidance.
Por favor, mueve una pizza. Perfecto. Muy bien. Me encanta jugar contigo.
Another lesson we learned is that the fluency in the communication is very, very important. At the beginning, we didn't have this expressive face. It was just the PAL Tiago robot that has 2 cameras. And the board was not sensorized, as it is now. And it took a while to respond for the robot. And this was not well taken by the patients. So we decided to do this, and now the interaction is much fluid. So we developed this iteratively with the management in the facility, with the neurologist, a clinical therapist, and a social worker, always trying to co-create. I should go first. All this leads us to see the importance of having a common ethical stance among all the stakeholders. And I like to convey that while AI ethics somehow lacked after, or the regulation at least, after it was deployed. In robotics, in this interactive type of thing, we have more time because robots take longer to be deployed. So we have the possibility to have more reflection. And I wrote a paper on all the differences and that there are risks that are magnified by the fact that the robot can move. For instance, spying, it can go to all places and see things and so on. And others that are diminished as well. And there are also new risks like objectivation and lack of control of the person. For instance, robots that can transfer from the chair to the bed and so on. Going very fast, since I was very concerned about this ethics deployment, I wrote a novel several years ago, which was translated to Spanish, English, and Chinese, and developed a course, because MIT Press wanted me to do so, to teach ethics in university, in these courses that are on professional ethics. So I did a teacher's guide and a 100-slide presentation that is being used in several universities, of course in Catalonia, but in the States also, and in several European places. And the materials can be downloaded for free here. These are the type of questions that are posed and answered based on the novel, in several paragraphs of the novel. And, well, to conclude, I went to this European Social Services Conference, and I was very glad to see that they are beginning to invest in social robots, mainly now in interacting by voice, say. But this can be very, very good, because there are many tasks that robots can do and give autonomy to people to live at home for longer. And, well, this could increase the autonomy of the elderly. It would also increase the qualification of caregivers, because caregivers could then take care of several elderly people at the same time and manage some technology. So the job description will be more qualified. And also this would reduce the burden of the healthcare system and for families. And this is what I wanted to say. Thank you.
Wow, lots to think about there. Thank you very much, Carme and Dor, both of you.